Complement fixation test. The gonococcus complement fixation test of Schwartz and McNeil is peculiar only in that the antigen employed is made from mixed strains of gonococci. The original antigen was made from 11 different strains, and as various ones of these died off or were lost, they have been replaced by others. The reaction becomes positive rarely before the 4th week, but usually in the 6th to the 8th week. It never becomes positive in cases that are so successfully repressed or aborted as never to have any considerable infection. The reaction usually remains positive as long as there is any active gonorrheal infection in the patient's body. Thus, a persistent joint lesion or tubal infection in the female may keep up a positive reaction after the urethral infection has been cured. 2 exceptions are to be noted in the time of disappearance of the positive reaction as follows. 1. The urethral lesion may become so slight and superficial that the complement fixation test becomes negative before the last gonococcus has disappeared. I've never known this to occur, excepting in cases of mild chronic anterior urethritis that reacted brilliantly to the passage of a sound in the form of an acute, obviously gonorrheal urethritis. This check can, therefore, apparently be relied upon, and the combination of a negative gonococcus fixation test with absence of reaction to the passage of a sound is an almost certain guarantee of cure. 2. The fixation test usually remains positive 2 to 6 weeks after all clinical evidence of infection has disappeared from the urethra and its glands, but it may persist for months. Such a persistent positive reaction is extremely unusual, but I have seen 3 men with a positive gonococcus reaction a year after the last trace of gonorrhea had disappeared from the urethra. Each of them was repeatedly tested by culture for gonococcus with negative results. 2 of them married and did not infect their wives, though the reaction of one of these was still weakly positive 6 months after matrimony. I do not know what focus of infection kept up the reaction in these cases. The reaction presents 2 interesting medico-legal features. 1. If within 3 weeks of the time when a fresh urethral discharge appeared, the patient's blood is found positive, the discharge is probably a relapse from a previous infection. If negative, it is doubtless a new infection. The nearer the test is made to the beginning of the infection, the more accurate it is likely to be. 2. The reaction of a person who has not recently had a gonorrhea cannot be made positive by the injection of gonococcus vaccines. But if the complement fixation test has been positive within the preceding 6 months and vaccines are given, it is readily made positive again. Diagnostic value. The accuracy of the complement fixation test, like that of the gonococcus culture, varies in accordance with the skill and experience of the operator. But, exception made for infection confined to the anterior urethra, technical errors are much less likely to interfere with the validity of the complement fixation test than with gonococcus culture. Positive culture, on the other hand, is more certain evidence that an infectious lesion persists in the urethra than is a positive complement fixation test. Nevertheless, the practitioner will be wise to rely more upon the complement fixation test than upon anything else for the diagnosis of the presence of gonorrhea.